So hello guys, welcome to my channel. The name is Dr. Brown, and today I'm going to be discussing with you a topic on vaginal discharge. So vaginal discharge is fairly common, and it's basically caused by bugs. There can be a lot of causes, but today we are going to be discussing the three most common causes. So let's jump right into it. So basically, vaginal discharge is caused by vaginitis, which basically is inflammation of the vaginal wall. Okay, the three main causes: bacterial vaginosis, trichomoniasis, caused by Trichomoniasis vaginalis, and then last but not the least, the main culprit, Candida, caused by Candida albicans, and then bacterial vaginosis is caused by Gardnerella vaginalis. Okay, so these are the three main causes of vaginal discharge. Basically, these bags will cause the vaginal wall to get inflamed, and then they produce a fluid, and that fluid is going to come out through the vagina as a discharge. Okay, so this is basically the three main causes. So with bacterial vaginosis, okay, the discharge is normally clear and very transparent, typically has no smell. Okay, and you can also have clear and transparent discharge, which is physiologically normal. That's not what we are discussing. We're talking about a discharge, which is a vaginal discharge. But the key is when it comes into contact with the male sperm. That is when you have this vaginal discharge and you have sex, you produce a very pungent smell. Okay, so after sex you realize that the whole place is smelling fishy. I mean, it can be very embarrassing. So if you realize you do have a discharge, that anytime you have sex, or anytime you have sex with your male partner, the whole place smells fishy. That is the type of discharge that you have. It's very important to get treated because this discharge can cause preterm labor. Okay, so basically we're talking about going into labor before being due, which is at 7 weeks to about 40 weeks. So typically pregnancy is supposed to be carried to term 9 months, which is 40 weeks. However, when you have this bug and you don't get it treated, the bug can stay dormant for so many years, and when you do get pregnant, you would realize that it could actually have preterm contractions and then eventually lead to preterm labor. So it's very, very important to treat this bug. You don't want to leave it untreated. Now, trichomoniasis, caused again by Trichomoniasis vaginalis. Of all the three main causes, this is the one that is sexually transmitted. So bacterial vaginosis, Candida, male can give it to the female can give it to the male. But with this one, both either sexes can give it to the other. So the male can give it to the female can give it to the male. So it's very, very crucial that you get it treated. And this discharge normally comes with itchiness. Okay, so you find that your genitals will itch a lot. Candida can also do that, but Trichomoniasis, is notorious for that. And the discharge with Trichomoniasis is usually yellowish and greenish, and also typically has bad odor. And this is slightly different from bacterial vaginosis, where we said the discharge is usually clear and doesn't have an odor until it comes into contact with the male sperm. So again, with this one, it's very, very crucial that you and your partner get treated. And again, has a yellowish or greenish discharge. So you always have to make sure you visit the doctor with your partner so that the two of you can get treated, your sexual partner. Because at the end of the day, if you treat yourself and your partner doesn't get treated and you come back and engage in sex with the same person, you're going to end up in a vicious cycle where you are going to get repeated infections again and again and again. Now, last but not the least, Candida. And, Candida is fairly common. Typically, the discharge is white, curdy, feels thick like honey. Okay, so that's the typical Candida discharge. also comes with itchiness a lot. So your vulva vagina area will itch a lot anytime you have this. Okay, and it's mainly the issue, or what predisposes people to Candida, is hygiene. Okay, so if you're not practicing good hygiene habits, you are basically setting up yourself to get Candida. So basically, not keeping your underwears warm enough, not changing them as regular, basic regular stuff. Now, the catch here is that in the vagina, there's what we call normal flora, okay, which is basically that there's bacteria which are found in the vagina, but it's normal. They are found can be found everywhere in the body, the mouth, skin, But when it's found, the normal flora of the vagina, mainly lactobacilli, they act to maintain the pH of the vagina in a fairly constant state. Okay. Now, if you're introducing all this foreign stuff into your vagina, all what you're doing is you are causing a disruption of the flora. So you're basically making the work of the lactobacilli invalid, because it's supposed to sort of keep everything in an equilibrium. But when you take in antibiotics and whatnot, it can interfere, because the lactobacilli in itself is also a bacteria. So if you take antibiotics, it can kill this lactobacilli, and then once it rules the pH, all the other bacteria which are not supposed to normally be there will be there, and they can prone you into Candida, which is actually a fungal infection. So if you go to the hospital and you get antibiotics, it can lead to that, but that's not the main issue. Introducing something foreign into the vagina can prone you into Candida, like when you're introducing all this antiseptic, all this vagina so-called tightness medications into the vagina, you are basically causing a whole disruption, and that can prone you to Candida. So if you do have Candida a lot, you have to check what antiseptic you're using. You can just wash the vagina with for normal water, that's no problem. But if you're using all this antiseptic, putting your fingers, oral sex, whatnot, all this can prone you into getting Candida, because you're basically introducing bacteria which is normally found at one part into the vagina. So this is what I have today. I hope you did enjoy the video. Do like, share, comment, and thank you for watching.